I'm Dr. Jorma Halttunen from the Meilahti Hospital in Helsinki. On behalf of the study team, I present our main results of a randomized clinical trial on benign biliary stricture caused by chronic pancreatitis. The study was done in 3 university hospitals in Finland, in Helsinki, Turku and Oulu. The authors are all GI surgeons, plus one statistician who took care of our numbers. In Finland, GI surgeons perform ERCPs, so in practice, the same surgical team takes care of the complications of chronic pancreatitis, treating them either endoscopically or operatively. For the past 20 years, endoscopy has been the primary choice. During 4 years, starting 2008, we collected 60 patients with obstruction of the common bile duct due to chronic pancreatitis. The patients were mainly males in their 50s. After the initial period, we randomized the patients into 2 groups. 30 patients received 3 10 French plastic stents into the common bile duct, and after 3 months the number of stents was increased to 6, and after further 3 months the stents were removed. The other group of 30 patients received one 10 millimeter wide covered self-expandable metal stent into the common bile duct, and the stent was removed after 6 months. There were a few migrations, 3 cases in the plastic stent group, and 2 metal stents had to be replaced at the 3-month ERCP control. The main outcome indicator of the study was to see how well the biliary duct stays open without recurrent stricture during the 2-year follow-up. The success rate in this regard was 90% in the plastic stent group and 92% in the metal stent group. So far, there has been only 1 late recurrence, and that was 4 years after stent removal. All other recurrent strictures were during the 2-year follow-up period, and all recurrences were treated again by placing a covered metal stent for 6 months again. So it seems if there has been no recurrence during the first 2 years, the result of the treatment is quite permanent. The study shows that a benign biliary stricture, in this case caused by chronic pancreatitis, can be treated with multiple stenting or with 1 covered metal stent with quite fair long-term result. As long as there's access into the duodenum, this kind of endoscopic treatment is a viable option to avoid surgery. In practice, using 1 metal stent instead of several plastic stents will be easier, as the metal stent doesn't need to be checked nor changed every 3 months. There are still a few problems which remain regarding the stenting time and the size of the stent. If you would use larger than 10 millimeter stent and leave it for longer time than 6 months, might still improve the results. In the study, the average length of the stricture was 3 centimeters, and the diameter about the stricture in the common bile duct was 12 to 30 millimeters. Looking at those figures, a 4 centimeter long and 12 mm wide stent would be a perfect fit. We have already started a randomized clinical trial to see if this idea, using a wider stent and longer stenting time, will prove in the practice. Thank you.